Now to the stories. We start from the Federal Capital Territory, where resident doctors have declared an indefinite strike effective from today, Monday, the 15th of September, citing government failure to address their demands for better working conditions and unpaid entitlements. This follows a one-week warning strike last week, with doctors vowing to continue the action until meaningful dialogue takes place. This comes less than 24 hours after Nigerian Association of Resident Doctors suspended its 5-day warning strike. The association's president, Dr. Tope Oshundara, confirmed the suspension, but the Abuja branch of the association insists on going ahead with the action. Resident doctors in the Federal Capital Territory, still speaking on the strike action, have declared an indefinite strike effective from today, Monday, the 15th of September, 2025. And as earlier mentioned, we talked about the fact that their needs are yet to be met, and that's why they're dropping their tools today. News Central's Aisha Salihu joins us for more update on this. Aisha, thanks for joining us. What is the general mood on the doctors choosing to drop their equipment today and begin the strike?
Thank you so much, Blessings. As you can see, I'm standing right in front of the Maitama District Hospital, and we have been going around the hospitals within the FCT, and even here where we are standing, well, we've spoken to patients, we've also spoken to members of staff of the hospital, other medical personnel, and from what we have gathered so far, we realized that the nurses who are on duty at the moment, Blessings, it's just like we're back with the strike issue again. You remember when the nurses went on strike, but now it's the resident doctors. And from the hospital staff that we've spoken with, they are saying that we know that doctors do not work in silos. They work with nurses, they work with other hospital staff. But now for the doctors here, they are on strike. So the healthcare service delivery is very, very skeletal. We have spoken with patients who are being turned back because they cannot be attended to since the resident doctors are on strike. It's just the medical officers and the consultants who are on duty at the moment, just seeing patients and without any serious recourse to what's actually going on. That's basically what's going on in the hospital at the moment.
So, I mean, we understand that the impact of this on patients and even the healthcare workers can't be a good one. So, so far, how is this impacting the patient care and the emergencies across the affected healthcare facilities?
As a matter of fact, I'm just stepping out from the accident and emergency ward, and I saw most patients just sitting there. Nobody is attending to them. It's just the medical officers who are available. Even some pregnant women are being turned away because there's nobody really no specialist on duty to talk to them. The resident doctors in the FCT are really taking this strike seriously because they say until their demands are met, they are not going back, even though the National Association of the Resident Doctors had suspended their own strike. But the ones for the FCT is still continuing their own strike and saying until their demands are met, they're not going back.
Are there any ongoing negotiations or responses from government authorities to the doctors' demands, or is it radio silence still now?
At the moment, there is no, I'm not aware of any negotiations going on, but part of their demands and what they keep asking for is the working condition of the doctors, the fact that they are spending long hours, working, and then since 2011, they're saying that the FCT has not employed newer doctors to work with them. So there is the toll, psychological toll on doctors. They're working long hours, and there is no new recruitment to help them with their work. And among other issues is the delay and failure to implement promotions, and then skipping policies of doctors who have passed requisite exams. And also they're talking about broken promises and lack of timely action by the FCT administration. And also they're looking at lack of inclusion and poor governance. And you'd recall that even some of their salaries were withheld salaries and non-payment of 127 members for their April 2025 salaries, which was withheld by the Federal Capital Territory Civil Service Commission. So these are part of the issues, and they're saying that until words are put to paper, they just don't want to go back with a verbal agreement until words are put to paper and they are being implemented before they can then say the strike will be called off. But right now, they are down in tools. There's no resident doctor attending to patients at the moment, especially in this particular hospital where I'm standing.
Aisha, Salihu, thank you for the update. We understand that this will have a dire effect, but we're hoping it doesn't have a fatal effect, especially on the patient. Thank you once again.